This is our afternoon session of the first day, and we're pleased to have with us the folks from DCS and Judge Mary Beth Bonaventura as the director and a couple of her people to help. Is your blue light on there? Okay, good. And DCS, I can't resist making these kind of comments, but DCS is an agency that in the last 10 years that we had broken out of FSSA and dealing with children's issues, and really it's really one of the best things that we did in terms of reorganizing state government. And so I feel very comfortable saying that our ability to serve children in the different ways that we try to do that has improved immeasurably, and actually has been done so with the ability to analyze our cost structure and not really reduce services, but make sure we get full value for the services that we have. And so, Judge, we're glad to have you here with us, and we look forward to your presentation, and hopefully if we have some questions, you'll be able to help us with those.
Thank you, Mr. Chairman, members of the committee. Thank you for allowing us the opportunity to appear here before you today. I am Mary Beth Bonaventura, the director of the Indiana Department of Child Services. This is my first, well, I was here last year, but this is like really the first this is the biennium and the first budget hearing that I've truly attended. So if there's anything that I'm probably doing inappropriate or not timely, just let me know, and I will modify what it is I'm doing. I'm going to introduce you to the two people sitting with me. To my left, to your right, is Rick Peterson, and Rick is our Chief Financial Officer. And to my right, your left, is Doris Tolliver, and Doris is our Chief of Staff. So we'll begin. We have a slide presentation for you. I want to walk through what our mission and vision is. This agency, under my direction, changed our mission statement a bit to talk about not only our mission is to protect children from abuse and neglect, but to work toward ensuring their financial support. As you'll see later in my report, the Department of Child Services also is responsible for the Child Support Bureau. And so to the extent that we can increase money that gets to children to enhance their well-being, that is our mission. And our vision, of course, is that children should thrive in safe, caring, and supporting families and communities. And also that we protect children who are victims of abuse and neglect and strengthen families through services that focus on family support and preservation. And as I said, we administer child support. And then, of course, adoption, which we'll talk about later, and foster care throughout the state. I'm going to do the first part of this presentation, and then Doris and Rick are going to do separate parts. So if you'll bear with me, this is our organizational chart, and you can read that so I don't have to read to you who all these people are, but as you can see, we have all these different divisions. Actually, when I took this job, I wasn't quite sure what everybody did until I got there, and it took me a good 2 or 3 months to figure out what everybody's role was, and saying who gets the contracts ready, and who tries to beef up our foster care, and trying to figure out all of that. There's so many moving parts to this agency that it can be quite challenging. So we'll move on then to what our strategic goals, which is building an enhanced automated child support system, ensuring the safety of Hoosier children through informed decision-making, beginning from the initial assessment, and all of this I'll talk with you a little bit more at length, promoting safe, timely, and stable permanency options for children, integrating a trauma-informed care approach to child welfare practice, and promoting a culture of staff development and continuous quality improvement. And let me just say to you that some of these words that we use, although they're not big words, they're words that are sort of our language. And forgive me if I use them and confuse you, but please ask me. I would be so happy to explain anything and everything. Not that you have that kind of time that we do, because it'll be important.
Since you say that, what does trauma-informed mean, actually?
What we know is that every child that enters the child welfare system is traumatized. In some way by somebody, and oftentimes even by us. Just by removing children from their homes is a traumatic event. And so why that has become so important to us as an agency, and I just left the Commission on Children meeting, and there was a woman who talked about being a survivor of sex trafficking, and she talked about trauma and how, we can remove children from situations that are traumatic. And what we did for years is we put them in safe places and thinking that love and a safe, warm environment was enough. But if we don't treat the trauma piece and what brought them to us, then we've really failed. And so we're really trying to focus at every step of our organization, even all of our workers and, and our support staff, to be trained about what trauma is and how we should be trauma informed to deal with that population. Did that explain it?
Yes,
Okay,
thank you.
great. Okay. So let me start with, we've given you the report. There's there's 26 pages in there for you to read about, but I've tried to pick out some of the highlights of what we've done over the past year or so, and I'm going to start with our Children's Mental Health Initiative. I know we have a lot of people in the room that either know about law enforcement or the legal field, and some even know about child welfare and juvenile delinquency, but oftentimes, when children present with mental health issues, historically, there really was no services or a lot of services for children of parents who didn't have insurance to access those services for their kids. So what would happen, just from personal experience, I can tell you that kids would present with either severe mental health issues or behavioral problems as a result of those mental health issues. And because there was nowhere to get help, their behavior would escalate to the point where kids would attack a parent, a sibling, punch holes in the walls, whatever, and the police would get called. And the police would come there and they'd bring them to my detention center. And so one of two things would happen. We would either have a prosecutor who would say, yes, this child has committed a delinquent act, and the parents wouldn't take the kid home because he was volatile or she was volatile, and we would keep them in a detention center. The child would become adjudicated a delinquent, thereby having a record following them the rest of their life, probably. And then we could access services for that child. Or, in the alternative, the court would say there was no probable cause that a delinquent act occurred, recognizing the child had mental health issues. And then we would have a Department of Child Services saying, if you don't take your child home with you, then the court's going to have to make them a ward, and that's how you can access services, because the parents, frankly, were frustrated. And so then we have a child and a family going through our CHIN system and becoming a ward of the state, and us providing services that way. So we thought, there just has to be a better way to not stigmatize children and to get services to children and families. So we developed, in partnership with FSSA and the Department of Mental Health and Addiction, and it goes really into a lot of detail in our report, but a method by which parents and children can be referred in the community to an access site, and they would be evaluated to see if they fell into certain categories. And so those categories would be that they'd have to be between 6 and 17, and that they would have to present with a certain diagnosis. And just about every diagnosis out there would fall into the categories that we determined were ones that we were seeing the most. And so we rolled it out, and so what would happen is they would not go through an official court process at all, but that families would continue to have the care and control of their children, but they would go into treatment. Most of them, we've had in 2014, we had 1,100, state fiscal year 2014, 1,108 referrals to this program, and 326 kids have received services paid for by the Department of Child Services without any court intervention at all. And so, and therefore, they're not delinquents or chins, and they're getting the help that they really need without having to go through a court system that would and a stigma for the rest of their lives. In 2012, it began, but in March of 2014, 2014, it was rolled out into all 92 counties. And we can get into the cost of that. I think it's later in this report. Let me see. I can tell you that we earmarked $25 million for this. Okay, thank you. We earmarked $25 million for this, not knowing what it would cost. In the first year, it cost us $8 million to provide services to those children, the majority of whom are served in their home, and we know that data shows us that serving a child in their home is 8 times cheaper or less than if we put children in residential care. I don't know if you want me to take...
Yes.
Yeah, go ahead. Thank you.
Are we going long-term about what these children? I mean,
I think that's the next step. It's so early in this process. A lot of things have come to mind, such as the supervision of this. We do have a facilitator at each of the community mental health centers that are involved with this process that are making sure the services are wrapped around the family and then following that child. Now we're going to begin collecting that data to see the outcomes of these children and how effective it is. You're welcome. The next thing that I want to talk to you about is our child welfare waiver project. It's kind of the waiver kind of throws me off personally because I'm not a money person, and so I'm not sure what waiver means most of the time, but what it means to Indiana is that we've been part of a demonstration project with the federal government that since 1998 has allowed us to get funds that we can use for child welfare services. And so from 1998 to 2012, it was sort of a very strict parameters. We could only spend $9,000 per child. We could only have 4,000 kids statewide involved in that. And but that was to pay for, most of it was paid for residential treatment for children that came through the child welfare system. But then in 2012, we were one of a handful of states that was allowed to have a different kind of waiver, which allowed us to spend the money more flexibly so that we could spend money like on the Children's Mental Health Initiative, whereas before we couldn't, because it seemed to be counterintuitive that if we're about keeping kids in the least restrictive environment and keeping kids in the home where we can safely, that we could only spend the money for residential treatment. Didn't seem like it fit. So the federal government recognized that as well and decided that to kind of take the handcuffs off and allow us to become creative and find ways to spend money. And they took that cap of 4,000 kids and $9,000 per child so that we could develop programming around keeping kids in the home safely when we could, knowing that that's really where children should grow up if we can keep them safe. So that's our waiver demonstration project. Rick can speak to this more, but I can tell you that we get about $88 million a year from the federal government through this waiver demonstration project. Next, I want to talk to you about our state adoption subsidy update. I am very excited about this because our adoption subsidy allows adoptive parents of children who are, God bless you, who are hard to place and children who have very special high needs to be able to provide services better for them and access services for them that they wouldn't otherwise be able to access. And so we all know, at least in the business that I'm in, know that what happens when kids don't get services and they have high needs, they end up back in our system. So I'm very hopeful that the adoption subsidy will not only attract more people to adopt this population, but allow them to remain intact in a loving environment. And so I will tell you that we had about 1,800 people. I'm very proud of the staff at the Department of Child Services. We have about 1,800 families or children that are were on this waiting list. And I can tell you to date, we have 577 agreements with existing subsidy amounts in the pay status because that was the amount that there were some that had zero negotiated. And so we've negotiated those amounts. We didn't think we were going to get payments out until Thanksgiving, and actually we got the first payment out about the second week of October. So they really worked tirelessly to get this money to the children and families. Okay, let me get to the Child Abuse and Neglect Hotline. When I got here last year, or actually in 2013, March, the hotline seemed to be quite a hot issue. But I can tell you, it's really, like from where I sit, I'd never had to be convinced about it back in the day, and I've been around long enough to know what back in the day meant. We had 300 ways you could contact the Department of Child Services to report abuse and neglect, which I think is really unconscionable as a state that we allowed that to happen. But you can't do everything all at the same time. But now we have one hotline. And so with that comes an increase in numbers and things like that as people get comfortable and know that it is a reliable way to contact us, and it's an anonymous way to contact us by law. We can't divulge who those callers are if they choose to remain anonymous. But in 2013, we rolled out to 4 new locations: Blackford, Lawrence, St. Joe, and Vanderburgh counties. Our calls increased, well, in 2009, we had 109,000 calls or reports to the hotline, and in 2013, calendar year 2013, we had 187,475 reports.
Judge, with the confidentiality agreement, do you think that the number of calls that are inappropriate or maybe being done for the wrong purpose, do you have some measurement on that? Do you think that's a minimal experience, that you're getting calls from somebody who maybe has a grudge against somebody else, or, the kind of circumstances I'm talking
We
about?
get those. I mean, I think, we get them all, probably a lot. But what happens, just so you know, when we get a call, our people at the hotline make a recommendation to the local office. And so at the hotline, we don't screen out, or we don't we don't say we're not assessing
Right.
this. We just send it
Just
to the
try to
local
take the
office,
call.
right? And I think that the value in that is that the local people really know who those people are in their
Okay.
communities. And so they then make the decision if the assessment should go forward
that
or not.
phase, yeah.
And that kind of filters out.
Good.
So yeah, I think we get some kind of crackpot calls, but I think for the most part, they're serious.
Minimal, yeah,
Yeah.
okay.
Okay, let's see. So we're sticking with the hotline for a little bit because I think this is important stuff for you to know that, so we had 156,000 calls and 14,000 plus were electronic reports. The average speed of an answer is a minute 19 seconds for non-law enforcement to get your call answered, and 28 seconds for law enforcement. So law enforcement, when they call the hotline, they have a code to put in, which pushes them to the top of the line. The average caller spent 11 minutes and 18 seconds speaking with an intake specialist. The average daily calls during the business week is 539, and the average calls on the weekend are 182. A lot of calls, yeah. Okay, and so next I'm going to talk to you about our Child Support Bureau. Actually, before I became judge, I was magistrate in Lake County, and I was the first 40 magistrate in Lake County, so this is kind of near and dear to my heart and something I know something about. And so the federal, through the Social Security Act, requires us, under Title 4D, requires every state in the country to have, and then every county to have a 4D court to collect child support. So not just only to collect, but the core functions are to locate parents, to establish paternity, to establish a support amount, and then collect on an arrearage. I will tell you that, I'm getting ahead of myself. I see my next slide, which is kind of nice, yeah. And so I just went through what it is from memory, and it's right there on the slide for you. So we do enforcement. Of course, we have the payment process part. The challenging part about our 4D and Child Support Bureau is that it's state administered. So we kind of do all the infrastructure as it relates to child support, and then it's county operated. And so the challenge becomes that our partners are the elected officials there, who are kind of different than us. We're all about kind of just, worrying about our business. And when you're elected, as everyone knows, pretty much everyone in this room, you have to think about who your constituents are, and there's other issues that really come into play. And so to build and keep those relationships is really vital and important to the success of this, to this initiative. So in 2013, our overall ranking on those measures beneath that you see was 10th in the nation. So in 2003, we were 35th in the nation in those performance measures. That didn't happen by accident, and there's a group of about 300 people in that Child Support Bureau that really work tirelessly to build and maintain relationships and process the money that comes in. And on the next slide, I'm going to show you how much that is.
You need to thank those people for us, because I know that 10 years ago, this was a monumental issue that everybody was screaming and yelling about. And so these measures, assuming their accuracy, are tremendously improved.
I mean, just to move it like one decimal is.
So we
very-
appreciate the work that those people do.
Thank you. I will let them know. And so to make sure that we stay on track and do even better than we're doing, we have to build an enhanced child support automated system because the system that we have is really antiquated and really outdated. So it has something called a COBOL system. When I was reading the annual report, going over it today, it never says it. So when we did our Good to Great plan with the governor last year, all the agencies had to do it, and we showed him the screen and then explained to him that that's what it looked like. He said that's all we had to show him, was just that screen, because it's just this green screen and has, I mean, it's like, and everybody's looking at me like, oh my gosh. So the young people in the room have never seen that. And so there's very few people alive that really can even service this, equipment that we have that has processed $1 billion in child support last year. And so that's the good news. The bad news is that we have a lot of children living in situations without both parents, which I think is the bad news for us as a society. But that's for another meeting. And so we have processed nearly $1 billion in support payments. It's used by 1,200 state and county child support workers, and it maintains over 287,000 active 4D cases. So 4D cases, again, are cases where the child has either received Medicaid or TANF or both, and 150,000 non-4D private cases. So people who are divorced and are paying child support, or people whose children never received state dollars or federal dollars, are processed through our Child Support Bureau as well. So the benefits of the new system is to increase child support collections for families and increase opportunities for collaboration, decreased maintenance costs, which is a big one, and increased federal incentive funds. So we get federal incentive dollars for every dollar that we collect. And so the more we collect, the more incentive dollars the state gets. And not only the state, the county gets it too, so the clerk's office get it, and the prosecutor's office get the funds as well. And just a plug for judges, the courts never get, by statute, they don't get any of the incentive money. Okay, so the case numbers, we're going to talk a little bit about our numbers of children that we have in care. And at the end of state fiscal year 2014, DCS had 8,769 open cases. That means assessments going on around the state. And then 17,471 ongoing cases. And so those ongoing cases below are kind of broken out for you. So 14,763 CHINS cases, 2,028 informal adjustments. So the informal adjustments are CHINS cases as well. They just haven't been adjudicated through the formal court process. It's an informal adjustment. It's almost like a contract with the family saying, if you do thus and such, you need to do it by this date, and if you do, then we're going to get out of your lives. If you don't, we can extend it for 6 more months, or we can file the case if you haven't done what we've asked you to do to keep your children safe. And then 680 collaborative care cases. Collaborative care cases have been CHINS cases, and they're children that have, someone said today, and I liked the phrase, matured out of the system. So now they're at an age where they've reached 18, and they're still in our care and custody, but their needs are different than the needs of an 8 or a 9 or 10 or 12-year-old. And so we've carved out collaborative care workers that are family case managers that are specialized just in older youth issues and services and care, and they then manage those cases. So kids can get in those collaborative care program one of 2 ways. One, they can decide that they want to stay in our care and then transition into collaborative care, which we build, all supports around them to support them into adulthood the way we would our own children. Or we can, wardship can be dismissed and they can ask to come in as long as it's before they age out statutorily, and we can take them back into care and provide services to them. I can tell you that I was at a conference on older youth last week, and Indiana is leading the nation in our collaborative care efforts and efforts for older youth, and I'm very proud of that. Okay, let's see. And so I've kind of broken down for you in the next slide about out-of-home placement for children and displacement in general. The goal for us has been to obviously keep kids in the home as long as they're safe. And when they're not safe, the statute says that we have to provide services that are the least restrictive to children. So the next choice for us, and really nationwide, is what the best practices show, is to keep kids with relatives, people that they know, providing the relatives can provide safety and permanency for them as well. So we're not going to place them with relatives just because the relative is available. They still have to meet, a standard that would show that the children would be safe. So you will see that in 2010, on the right, 51% of the kids lived in non-relative foster care. Relative was 35%, 12% was residential care, and then 2% was other. And you can see in 2014 how really dramatically the relative foster home care increased, and that wasn't by accident. We have family case managers that specialize in relative care to locate and identify and support relatives. We used to just place kids and say, here, you know, Aunt Susie, you can have the child now, and walk away, and then in about a month that would blow up because the child would have issues, but now we don't do it like that. Some of those people choose not to be foster care placements, and others do choose. So relatives have the choice of either becoming a foster parent, which would mean they would get paid to do that the way any foster parent would, or some choose not to do that. 47% of the kids are in non-relative foster care, 7% are in residential, and then 2% other. All of that said, I will tell you that we will unfortunately always have a need for children to be in foster care and in residential care. Some kids just cannot be maintained in foster care or in their own homes and need a short time to be in residential so their issues can be addressed and then eventually return home is the goal. Are there any questions about my part? Because I'm going to turn it over to Doris about staffing and things like that.
The adoption subsidy issue where you reached a settlement there, how does that play in on the cost structure, or do you want the financial guy to? He can talk about that later. That's fine. All right, good.
And then whatever other questions, I'll be happy to answer. But yeah, Rick is going to address that. Okay, thank you.
Alrighty, so I have the pleasure of talking about our staffing through state fiscal year 2014, as well as our caseloads. And as all of you are probably intimately aware, statute requires Indiana's Department of Child Services to report out annually on where we are with respect to staffing and caseloads. And so I will talk a little bit about that right now. Before I do that, I wanted to update all of you on where we are, where we were at the close of the last state fiscal year with respect to our additional staff that were added as part of the 2014-15 budget. We created an additional 136 new family case manager positions, all of which have been filled. In addition to that, we created an additional 75 new family case manager supervisor positions, which have also all been filled. Following our annual presentation last year, we requested and then subsequently created an additional 110 family case managers due to two things. One, the change in methodology with our caseloads, the way that we calculate our FCM caseload data, 12 and 17 data, as well as the increase that we saw in our case numbers, both on the assessment and CHIN side. And we had also had a period where we experienced relatively significant high turnover. So to that end, we created an additional 110 positions. 109 of those positions were filled over the course of the last state fiscal year. So we have done a pretty good job in staffing up with the newly created family case manager positions that we added over the course of the last couple of years. The director spoke about our regional hotlines, and so just a quick update on where we are with staffing those hotline locations. Blackford and Lawrence are what we envision being our smaller locations, with St. Joseph and Vanderburg being in larger geographical areas that had larger populations. So we planned and allocated positions accordingly. Blackford and Lawrence are fully staffed with 5 intake specialists, in Blackford 1 supervisor, and in Lawrence 6 intake specialists and 1 supervisor. St. Joseph County, we have filled all 4 of the supervisor positions and 12 of the 20 intake specialist positions. And in Vanderburg, we experienced the most challenges in staffing that location. and have filled 3 of the 5 intake specialists that were added to that site, and then 1 supervisor position at this point. We have, the director mentioned during her presentation, call times. We are managing the call volume with the current staffing that we have, but we do have a pool of vacant positions that we have ready to fill should we start seeing an uptick in call wait time so that we can effectively respond to those. Over the last couple of years, we've increased our efforts to recruit and retain a workforce. We know that for all organizations, all operations, staff turnover can be a huge drain, both fiscally and operationally. In child welfare, I think that the impact of staff turnover is much more significant and has an impact on the actual outcomes of kids with whom we are involved. So we've put a lot of effort and attention into our recruitment efforts, expanding our recruitment tool set, utilizing social media, increasing our presence at job fairs throughout the state. We increased our allocated slots for Bachelor of Social Work scholarships, a social work program that is in collaboration with the IU School of Social Work, and also partnering with other state agencies in the child welfare space, a lot of our provider community, to problem solve ways to sort of bolster the field more broadly. So talking about the impact of some of our efforts in hiring and retaining staff, I'll go into a little bit of detail there. We've made great progress or measurable progress with staff turnover since 2012. At the end of state fiscal year 2012, our negative turnover rate for family case managers was 19.8. Actually, it peaked in November of calendar year 2012, reaching just over 20%. Since then, we have, again, made great strides in reducing our staff turnover. At the end of state fiscal year 2014, our negative turnover for family case managers was 16.9%. And let me just clarify for those of you who may be wondering what negative turnover means. We recruit heavily into our management ranks from family case managers. So family case manager supervisors are by and large promoted from family case manager positions, our local office directors and up. So, and then we also have other opportunities, specialized types of opportunities for former family case managers to serve in the agency. Negative turnover reflects the turnover where folks decide that they no longer want to work for the agency, versus family case managers leaving the family case manager role to promote, for instance, to a supervisory position. So it really looks at that undesirable turnover from the agency. Some of the strategies that we've employed to reduce our turnover include establishing a critical response support team. We know that, the director talked about trauma-informed and what it means for the children we serve. There is also trauma that occurs in those workers that see the things that they see when they go into a home and when they're working with families, when children are disclosing to them. Those staff who work in our central office and who are reading fatality reports, there's trauma that goes along with the work that we do. And so we have increased our effort by establishing this team that's nationally recognized, a team of, it's kind of a peer-to-peer support system where we have folks who have gone through this national training on critical response, and we deploy that team when there is what we call a critical incident. And a critical incident can be a horrific child abuse incident. It could be a high-profile incident in a local office or in a county. It can be an unexpected event to another staff member in the office. We have a local office director who passed away suddenly earlier this month, And we deployed our critical response team to support the workers in that office and show them, that not only that we care about them, but we want to try and support the work that they do. We implemented salary increases for our field staff, which was supported by the legislature in our change package for our current biennium. And then we also implemented some employee recognition events. So we've tried to really engage in and foster an environment that that recognizes the difficult work, the difficult nature of the work, and also demonstrates to our employees that we support them. I will say that we know that staff turnover in this field is never going to be at zero. I don't know that we ever want it to be at zero. There is a time at which most people working in this field will reach their limit such that they can no longer be of great value to the kids and families that we serve. And so, but we're trying to get that level to the right level where we have a sustained, stable workforce and have opportunities for folks to move on and refresh when they reach that point. We've looked at other state turnover rates just to see kind of where we are comparably. Unfortunately, there's not good national data. There's not like a clearinghouse that collects nationally data on child welfare systems. But in looking at some other states, we found that, that lots of states are higher than Indiana. So sometimes you need that context. How are we doing as compared to some of our partners in this work? Arizona's turnover, their average turnover statewide at 25 to 30%. Wisconsin, 39% turnover for their ongoing case managers. And Florida at 23% turnover for their child protective investigators. And again, I say that just to provide some context when we're talking about turnover. Of course, we'd like it to be as low as possible, and we're still kind of working to find where that takes us and what that appropriate level is. So moving on to caseloads, one of the things that the director called out was the actual numbers of assessments and CHINS cases that we had at the end of the last state fiscal year. One of the things that I would like to note is that at the end of state fiscal year 14, we had almost 1,800 more open assessments that we did in June of 2013. We're seeing an increase in business. Director Bonaventura also talked about the comparison in hotline volume over the years. We're seeing an uptick in reports, we're seeing an uptick in assessments, and we're seeing an uptick in corresponding cases that are then open as CHINS or informal adjustments. With respect to our 12 and 17, it's calculated using monthly caseload averages in all of our 19 regions. We have 18 field deployed regions, and then we have an additional central office region that includes our collaborative care and institutional assessments. I was like, what is the other one? Institutional assessments. Those are specialized case management functions that we carved out. The 12 in the 12 and 17 standard refers to active cases that are being assessed or investigated for allegations of abuse or neglect. The 17 refers to those cases where the children are being monitored or supervised in ongoing cases. So we've substantiated abuse or neglect, and we have opened a CHINS or we have an informal adjustment. A residential placement in our methodology is weighted at 50% of a CHINS case. And that's because of the day-to-day involvement that the residential provider and their staff have in doing a lot of the functions that a family case manager would typically perform in a case that is where the child is either in home or in a foster placement. And this is another one of those areas where we looked at, again, and looking at some of our partners nationwide to see what other models are out there so that we can get this right. There are lots of different ways that caseloads are counted. There are different statutory or other schemes with respect to how they identify an appropriate caseload or workload for their staff. Some states determine caseload based on the number of children, while others may weigh cases based on the type of case that it is. And some states have different caseload standards for new workers versus their more seasoned workers. So a year-end snapshot of where we are, where we were with respect to caseloads at the end of state fiscal year 2014. We had 1,459 filled FCM positions that are deployed to the field, and an additional 139 FCMs that were in training. We started 22 new family case manager cohort classes. On average, those classes had 25, sometimes upwards of 30 new family case managers in a class. And that resulted in us deploying 411 new family case managers to local offices during state fiscal year 2014. Unfortunately, and then we had 86 vacant positions at the end of the state fiscal year. Unfortunately, all of those gains that we made with reducing our turnover, with hiring new staff, resulted in us meeting 12 and 17 standard in one of the 19 regions, and that one region being our central office region that's, again, comprised of our collaborative care and institutional assessment units. In order to meet the 12 and 17 standard, it would require us to add an additional 77 new family case manager positions and deploy those across the state. Our goal today, in now then addressing or moving to our plan to address our non-compliance with the 12 and 17 standard, is to really take a fresh look at the work that our family case managers perform and achieve two goals. One, we'd like to commission a study that looks at our workload, or the workload of family case managers. We know that operationally there have been a number of changes in the tasks and duties that family case managers perform since DCS became a standalone agency in 2005. So, and the other prong to addressing our caseloads is reinforcing and promoting quality leadership through an enhanced supervisor training program. Most of what I will talk about, and I'm almost done with my presentation, but most of what I will talk about in terms of our approach deals with the workload analysis. As I mentioned, we know that, that the job duties that family case managers perform has changed. I don't want to say dramatically, but has changed to a fair degree. We've specialized a number of functions. We've increased our support staff, our number of support staff who can potentially take on some more ministerial responsibilities. But our goal in conducting an analysis is to learn how we can implement measures and what measures we can implement to ensure that staff maintain manageable caseloads, particularly in light of the fluctuations that we have experienced, and I'm sure we will continue to experience with respect to our caseloads. Our goal is not to keep just throwing positions out there without at some point conducting a reassessment to see where we can improve processes, where we can shift administrative functions, where we can leverage technology more effectively, and then ultimately what that means for our family case managers. So we'd like to commission a study of that sort to help us answer those questions. We have initiated some conversations with some prospective vendors. We have reached out to some of our national partners in the child welfare space. Casey Family Programs has been providing us with some consultation on approaches that we can take to an analysis of this sort, so that we can, make the improvements that we think will help provide us with better information with respect to what that means for our case managers. And then the other prong that I mentioned was with respect to improving our leadership training. We have a supervisor training for family case managers, usually who promote into FCM supervisor positions. We know from our own evaluation mechanisms as from research in not only the child welfare space, but across industries, that frontline supervisors are generally the biggest impetus behind workers leaving. And so to the extent that we can improve upon the development of our supervisors so that they can most effectively support our workers, so that we can continue to ensure that, that we have turnover as low as possible, we have committed some efforts to that. We actually have a plan that we will be rolling out January of 2015, which is our enhanced supervisor cohort training that better mirrors the structure of our family case manager training, where we start all new supervisors in a cohort of sorts and bring them through a formalized training program that touches on the components that we think will help them to better support family case managers. What questions
Brown.
do you have?
Thank you. Thank you for your presentation of information. Just a couple quick questions. You talked about a residential placement is 50% of Chin's case. Is there any changing of that weight as they get ready to transition to home? Because it would seem to me that a local case manager might have more responsibility and more task as they transition closer to home.
There, you know, at this point, there is not. I'm going to make a note of that and talk with our data
Okay.
guy.
Okay.
and-
And then you do talk about that you said to meet the 2017 DCS goals, you'd need an additional 77 FCMs, field case managers. Is that addition to the 86 vacant, or is that is 77 part of that vacant positions?
77 would be additional PCNs above what we have right now. So we know that we are always going to have some vacancies. And so that would be, again, similar to our last year when we were talking about kind of staffing up. That's what that would be staffing up to allow for a vacancy rate that we know we're always going to have.
Okay.
So that we have 77 additional deployed family case managers.
And I guess I hear that because of the increased volumes, kind of year
Yes,
over year,
absolutely.
that's been trending.
Absolutely.
Okay, okay.
And that's, I mean, I talked a little bit, and I didn't bring data on other states, but we've in conversation with other states and where they are with their caseloads, there seems to be a national trend with caseload increases. And, I know that Rick and I have had conversations about other states that he's spoken to as well, and the increases that other states are experiencing. I'm not sure what to attribute that to.
Well,
It seems like a pretty sad commentary.
Yeah, it does. Because we do know during still tough economic times, caseloads go up, and it seems to be an indicator that caseloads go down as recovery increases. So
Sure, yeah.
that makes me worrisome that recovery isn't as strong or taking as foothold as well that we'd like. Okay.
And we know that our hotline reports have gone up substantially. Can we say that that's because people are seeing more abuse or neglect, or is it because we've been doing a lot of messaging, which we have about reporting abuse or neglect? I mean, it's again, it's a sad commentary that we're getting out there and messaging that we really want the community to get involved and call the hotline if they suspect abuse or neglect. The fact that they're taking us up on that is really important, but it does have the impact of increased business.
And I know we've asked this question before, but maybe for this hearing, you could restate. I mean, what does it take as far as qualifications to be a field case manager? I mean, just a bachelor in social work, or just any bachelor position, or do you take?
It requires a bachelor's degree. It can be in any field. We have a preference for a bachelor's of social work because data shows that they have better outcomes with kids and families. But the minimum requirement is a bachelor's degree. If someone is coming from a non-social science field, psychology, sociology, then they have to have some coursework in a social science field in order to qualify for family case management.
Have we worked with Ivy Tech in developing maybe an associate level, getting into entry level, progressing up to the bachelor degree or type of thing?
We've had
Since
some
we have so many Ivy Techs.
We have not had any conversations with Ivy Tech, but we have had some conversations with, which doesn't help with kind of the associates moving into a bachelor's, but to help to kind of increase the messaging and bolster the skill set of folks coming from other degrees. We've been working with IU on a certificate program where they can take kind of specialized child welfare coursework that is some of the coursework that's part of our BSW Scholars Program that, you know, it sort of gives them a leg up. One, it helps them to get a better sense of what this job might entail, particularly if they're coming from another type of degree. And it sort of secures some additional, you know, kind of recruitment and buy-in earlier on in their academic career while they're making those types of decisions.
And to go to a supervisor, does that increase any more formal training other than your training? It doesn't
It does not. The
require
thing that
master of
increase-
social work, does it?
What increases for our supervisors is their experience level.
Okay. Appreciate your information. Thank you.
You know, Dr. Brown's comment there about discussing this with Ivy Tech probably be worth at least a discussion, because if you have particular areas of shortage, if Ivy Tech were able to satisfy your need on the certification, then you're probably training people who live in that area already, and you might have a better chance
Yeah.
with them. I mean, it's probably worth at least looking at it. Senator Broden?
Thank you, Mr. Chairman. Thank you very much for the presentation. I certainly want to applaud the department that the statistic on getting over 400 new family case managers trained and out to various offices in a year is really impressive. I did want to follow up, and I guess I didn't quite understand your answer to Chairman Brown's question. So we have 86 positions that are open, is that correct?
Correct.
And a lot of that, I think you indicated, is just sort of due to the natural ebb and flow of people, you know, going out of the workplace, choosing to do something else. And then to get to the 1217, you mentioned the 77 additional positions. So does that mean if we were to get the number from 86 down to 9, or whatever the math is on that, but you're saying we would still need an additional 77 on top of that to get to the 1217?
If we were to have turnover such that we only had 9 vacancies
Okay.
on average, then we would, you're correct, we would not need any additional new
Okay.
positions.
Okay.
But I say that, and I also say that we are not here today asking for additional positions.
Okay.
But we know that it is unrealistic to think that we would only have, on average, 9 vacant positions at a given point in time.
Just not how it works. Yeah.
It's not I think that would, and I'm not a math person, that's him. But that would be like 0.0 something percent turnover, which is unrealistic.
Okay. And then just one follow-up question. Seems to me this is quite a number of years ago, but when I used to work more closely with family case managers, it seemed like some of the best ones, frankly, were ones that had sort of transitioned from other fields. And actually, I know in one occasion a police officer who had done his 20 years, but, you know, frankly, was tired of back and knee issues. And while being a family case manager isn't easy, it's a different skill set. But I remember he made an outstanding family case manager. And just sort of there were some that sort of had eclectic backgrounds. Do you use your social media in any way, not to necessarily raid other fields or raid other employers, but sort of, you know, to mention to people that, you know, hiring someone who, you know, might be 45, 48, you know, might be actually an ideal hire with sort of that real world experience that goes along with that?
One of the, so I don't know what you mean by rating other employers. One of the things that, or the approaches that we began last year, might have even been the year before that, was we started having open houses at local offices and doing a lot of local advertisement in, newspapers, local TV stations, local radio stations, and promoted folks who have an interest in child welfare, whether they're coming from another field or what have you, but to allow for it kind of basically a walk-in. And we have hired police officers, actually, is not an uncommon field for us to hire from, particularly on our assessment or investigation side. That skill set actually lends very nicely to our assessment workers in particular. So we have hired folks from other fields. I will talk with our HR director about some of the more targeted recruitment of other fields and looking at where there might be a good crossover appeal. Thank you for that idea.
Representative Clinker.
Thank you, Mr. Chairman. Can I ask you approximately what is the pay of a family case manager as they're starting?
I don't remember. I thought it was 36.
Starting would be 35.
35,000?
35,776.
Very good. And that's more than a beginning teacher. So, and did you mention they have to have a master's?
They have to have a bachelor's degree.
A bachelor's degree. And what is their capability of getting perhaps an encouragement for maybe an increase in pay over a period of years? Do you have a set situation where they increase?
We don't currently have like a tiered salary structure in place.
That's,
We
you do not have.
We do not.
It's just what the state maybe decides on an increase, like
Yes.
maybe
Yes.
1 or 2% a
Yes.
year for all of our folks that work for the state.
Yes. Now, what we did do is we did kind of carve out a little bit of a structure in distinguishing family case managers in that trainee period, so while they're in training, versus when they then move on to the local office and carry cases. When they start as a trainee, they're at 33,748. Once they finish their training period, that's when they bump up to 35,7.
Another question, special needs adoption dollars. Representative Budak and I passed that in an interim study committee that parents who adopted special needs children would receive subsidies. That was in the 80s. I'm pleased to see you're taking care of that. I'm sorry it took a lawsuit to do that. Maybe you would have done it anyway, but what position are we in as a state, and what are we doing about the special needs adoption parents? And you were mentioning adoption, Judge, a moment ago. Have we paid those people, and are the folks cognizant of what's happening with special needs adoption children throughout the state?
We have begun paying those people. There were 1,800 people on a waiting list. Yes, and so it's a process to find out where do they still live where they lived, when they went on the waiting list? Have the children, aged out, things like that. So that was a process, but about 544 people have been paid so far out of that list.
I was going to
Getting
say,
through.
how did you keep track?
Oh, believe me, you'll have to ask Rick, because they've worked literally till 8 and 9 o'clock at night to try to get those payments out.
I was just going to say, there were 1,800 and you've paid 544.
Yes. Is that good? Go ahead.
Yeah, and
Can you tell me why the state wasn't doing that all the time when it was by law that we were supposed to help special needs?
Representative Clinker, that was a subject of an intense discussion and a lawsuit, and that would be literally, we could be here all week dealing with on that. I don't know
Not aware of that.
that there would be a value for this. I'm trying to get to Mr. Peterson and get some hard numbers on his budget requests. I'm looking to the future, not to the past.
Well, I'm just pleased.
Yeah.
I wanted to thank you and the folks who discovered that, whether it was a lawsuit or by how. Whatever method, I appreciate the fact that you folks are
Thank
are
you.
taking care of that and doing that. And 544, I think, is a really good number being taken care of
Hopefully, by the
already.
end of the year, they'll all have received payments.
That's great. Thank you very much for
Thank you.
doing that.
Thank you.
Mr. Peterson.
Thank you. I'll give an overview of our budget request for the next biennium and then provide some additional details on the state adoption subsidy. We're currently at a budget of $551 million general funds. As we look to the next biennium, we're starting from a base of over $535 million, walking up to a request of $546.6 million in the first year of the biennium, and then $546.8 million in the second year. In that $546.6 million request for the start of the next biennium, we do have two change packages to propose. The first is a reallocation of our fund structure. So this one is a $0 impact, and we'll give you a little more visual of that in a subsequent slide here in a minute. The other change package does pertain to the state adoption subsidy and does pick up going forward and continue to fund those subsidies throughout the next biennium to the tune of $11.2 million in the first year and $11.4 million in the second year.
Rick, on the state adoption subsidy, I'm a little, I've heard different explanations, and one of them, there was some indication that the federal government was going to pick up some cost down the road in the future. But in a further explanation, my understanding is that they would not pick up that cost with respect to current recipients, but only to new people coming on, so that we would have a continued liability as a state for an extended period of time going out. Do you have something that covers that issue in this Okay, fine, I'll wait. Thank you.
This slide, just a little more background on the reason for the $0 change package to restructure our funds, really consolidate our funds. We currently have 22 funds, and that there's a lot of remnants there to not only pre-property tax reform in 2008 when the counties were still contributing to child welfare funding, but also really going all the way back to DCS's beginning in 2005 and prior to that. So we thought it was time to simplify, make it more transparent and easier to track. Of those 22 funds, we'll collapse it down into 10 funds with this proposal.
Now, one thing that I noticed was that in the earlier, on this summary sheet we got, it had all the federal dollars in one line, and then going forward, you had allocated that out among different programs, but I assumed that that was just one of these types of changes. Is that right?
We'll have one federal fund, but we wanted to illustrate with the restructuring, collapsing the funds that we take from our general funds budget and use to match federal funds. We wanted to structure those into three different general funds appropriations, and that's why you see that federal fund broken out on.
As a newer agency, have you had a chance to evaluate whether or not you're drawing down the federal dollars as best you can, or is that kind of a continuation of an ongoing practice, or?
A continuation, something that we continually look at to make sure we're maximizing our available resources at the federal level for child welfare. And really the waiver that the director spoke to earlier in the presentation is one recent example of that. While we've had a waiver since '98, we've evolved in how that waiver is structured and the extent to which.
Sound like a pretty beneficial change there, yeah.
So This chart, apologize, it's kind of hard to read up on the screen. You'll actually see on the left-hand side a representation of the current fund structure, but there's actually more than 22 lines there because we feed over onto the right-hand side the proposed structure, and there are existing funds which feed more than one of the new proposed funds. So you're better than 22 funds on the left and go into the proposed 10 on the right. Just real quickly, we'll get to a point where hopefully with this, it's easier for you to see. Family and Children Fund remains largely the same. It's our services, pure state dollars for children, both in out-of-home placement, also that we're serving in their home, though. The next grouping there, Child Services Administration on the right, that will represent our pure state dollars for administrative costs. Beneath, you'll see Child Welfare Program for DHHS. That's state's investment to leverage federal funds for child welfare services, as well as administrative dollars for that. Same with the following box there, the DHHS Title 40 adoption services. Again, state funds to leverage those Title 40 federal dollars for adoption. Our state adoption fund remains standalone, and this is where we had been funding county adoption subsidies that we had assumed in 2009 for children that were under 18 and were being paid with county-only funds that we continued to pay them up until age 18. And will also be the fund in which we propose the change packages going forward for the state adoption subsidy. Then you'll see our state investment for the federal child support dollars. And then really the bottom groupings there of funds are prevention dollars. This was put together working from that. You see we compare it to show that we're the $0 change going from the current biennium into the next biennium, working with the dollars in our $535 million base. So to the state adoption subsidy, again, over $11 million in each of the 2 years of the biennium for the state adoption subsidy going forward. You'll see references here to just under 1,600 children going forward in the first year of the biennium, just slightly more than that in the second year of the biennium. Relative to those figures that Judge mentioned of about 1,800 kids on the wait list, that was our entire wait list where we had accumulated over the 5.5 years where that wait list was active. So that includes the 1,800 figure included children that have since aged out and going forward will not be on the state adoption subsidy program. So the 1,600 approximate number of children would represent where we're at going forward in the biennium. And this slide does speak to, Mr. Chairman, what you referenced with the relationship of our state's adoption subsidy program as well as with the federal adoption program, which Indiana administers on behalf of the federal government. So since 2009, we, along with other states, have been given the opportunity to phase in new eligibility criteria for the Title 40 Adoption Assistance Program. It's been moving to an primarily age-based eligibility criteria, moving away from an eligibility criteria that was based on the child's eligibility for Title 40 assistance while they're in foster care. This is a favorable change for states. Because moving away from those Title 40 foster care eligibility criteria gets us away from what's really an eligibility system built off of the old pre-welfare reform AFDC program, which was centered in 1990. state's income guidelines. I'm sorry, Mr. Chairman.
No, can you give me a feeling for example, what the average subsidy is? And then how do you ensure that you have accountability of the use of the funds by the individual family? Do you have any system to do that?
On average, particularly looking at the state adoption subsidy program, assumes about a $19 a day average per diem.
Okay.
We looked at what we had been seeing for average per diems negotiated for the federal program that we're administering, and also looked at what many of those adoption assistance agreements that had been entered into in the early stages of the state adoption subsidy wait list, where they had a per diem on the agreement. We also have children on the wait list who had been children who were those old county adoption subsidy recipients that we paid up until age 18. Then they were placed on the wait list. If
So
they
it's
were
about
eligible.
$540 a month would be the average on that. Yeah.
So overall, going forward for the state adoption subsidy, we did a weighted average to come to that $19.
Okay. All right. And then what about the accountability side of the thing? How do you cross-check that?
I would say first on whether it's for the federal program or for the state adoption subsidy, we do surveys of the adoptive parents. We can do that annually. We haven't always done that annually, but we did the first couple of years following the centralization after property tax reform. We did a couple rounds of surveys to all adoptive parents, essentially asking them, do they still have the child in their care? Are they still financially and legally responsible for that child? And there's a series of questions to attest to that. And in doing that too, that does enable us to ensure we do have more up-to-date contact information.
Do you have the legal ability, if you feel that, or have information that it's not being used by the family for the benefit of the child, to go in and investigate it or determine whether or not what's going on and those kind of things? Like,
Usually the first step of that, if we become aware, we might even become aware of a child coming back into our care. We see an invoice come in for a foster care placement.
Yeah.
We go to pay that foster care bill. We get a warning that we're also currently paying that same child an adoption assistance per diem. So we will certainly investigate at that point, starting with one of those surveys. Again, is usually the first point of contact with the parent to reach out.
The reason I'm asking the question is that most of the social service systems, anytime you give direct cash payments, you always have all kinds of other factors that come into play at risk here, where the people who are doing the caretaking they want the cash to spend for other reasons. And so I'm trying to determine if we have, now that we are kind of reaching a conclusion on what our obligation is here going forward, if we have an adequate system to be able to deal with those cases where the situation's being abused by the person receiving the cash. And so you don't have to answer that question in full detail. Maybe somebody could just send a brief memo back to the committee or something, say, here's what we do, or here's how we check. But I'm not feeling from your answer a sense of comfort that comports to my experiences in watching statistics in other situations about that, okay?
Just briefly to that question, and I don't know that this really addresses it, but I can tell you that there is, in the last legislative session, an adoption committee that was created. And they have been meeting, they've had their third meeting now, and they will make a report back. But hopefully out of that committee, they will be examining maybe better ways for us to identify and assess how much money, if any, should be paid to any given person that's requesting it. And, just maybe some creative ways of supporting families other than a direct cash payment. that's supposed to be part of what their charge is to explore that.
I'm not suggesting that you shouldn't do cash payments. I just think that there needs to be the opportunity and the ability to monitor, and it might even be a managed approach to this, where you look for certain identifier signs of what's going on in a family, and then the worst case scenario would be that we're handing out this money to them, and then all of a sudden, here comes a newspaper article that verifies that the parents are using all the money to purchase illegal drugs or something like that. I mean, none of us want that. That would be just the worst possible result. So I just want to make sure that we have a balanced system that respects all of the different interests involved here, that does make sure that we're getting utilization in a proper way.
We'll get you what the process is that we currently have, part of our continuous quality improvement is to always look at better ways to do it. So I appreciate the comment, and we'll keep that on our radar to make sure that we address that.
We want the money to go for the benefit of the child.
That's what we want to.
Senator Broden.
Thank you, Mr. Chairman. I don't know if this would answer the chairman's question, but I know at one of Senator Yoder's meetings on the oversight, at least I think that's where it was, it did seem like the department was much more rigorous in terms of when they award the subsidy, getting information on how much the parents actually spent on the child, and sort of in determining what that actual subsidy amount should be and how it varies from family to family. And I guess that wouldn't address Senator Kenley's question as to how the money's actually used. It's sort of hard to almost know for sure on that, but I certainly would applaud the department for it. It seems like they go to great lengths to try to establish what each family plans to use that money for, in terms of asking those detailed questions. At least that's my perception. I don't know if that's true or not.
Well,
But
it is true. I can guarantee you that it is not a rubber stamp. I mean, in fact, it used to be that at every county, the local office attorneys would be the negotiator of that amount. And I didn't like that approach, because I felt that we would have people that weren't good at that. Not all of us are good negotiators, even if we are lawyers. And so we trained nine of our local office attorneys all over the state in negotiation techniques, and they are the ones that negotiate it. So we have specialists in negotiating that, and we take it very serious. And so it's not a rubber stamp, I assure you.
Well, we have the benefit of your many years of experience of being a retail on-the-line judge dealing with these issues, and that's so what kind of things I'm talking about here. And we need to make sure. I just want to be reassured that we are doing this in an appropriate way.
Thank you.
Other questions? Well, that wasn't too painful, was it?
It wasn't painful at all.
Thank you for coming and sharing your story, and we do appreciate all the work of the people at the agency. I know that there's been a lot of pressure and a lot of intensity on the hotline and on the case management system and all of these things, and so this is a good report, and we're glad that it's working.
And
Tell your employees we appreciate their commitments.
I want to tell you that I am, looking back on my life and my career, I have zero regrets in taking this position. The people that I work with at this agency are so bright and committed and really working for the best interests of children and families, and I'm very honored to be able to work with them. So thank you.
Thank you. It's a good testimonial right there. Let's see, we're scheduled not for next week, but tomorrow. What time do we start tomorrow, David? Start at 9 tomorrow. Oh, we got the lieutenant governor. We all got to be here by 9. She likes to be on time, everybody. Thank you.